Leone is a small country in West Africa that experienced 10 years of civil war which devastated the healthcare system. This was followed by the recent Ebola outbreak in 2014 and 15 that killed nearly 4,000 people. The vision of Rural Healthcare Initiative is a thriving Sierra Leone where healthy pregnancies and healthy children are expected. Our mission is to partner with rural communities in Sierra Leone to restore the healthcare system and to improve health outcomes for mothers and children. We are reporting back to you what RHCI has accomplished with your generous support since 2011. On January 13th, 2018, the Baumi Mother's Home, the birth waiting home, opened in Takanko. Built during 2016 and 2017, this home, which was funded entirely by our donors with no government support, provides a safe place for women to stay during the final weeks of their pregnancy. This brings the women from villages as near as 1 hour walking distance to as far as 6 hours walking distance, close to where they will give birth, and to have skilled health care at childbirth. While they're at the home, food, educational classes, and activities are provided. The Baumi Mother's Home has been very well received and has been filled to capacity with up to 24 women staying there for the last several months. Pregnant women come from villages such as Lembama, which is 2 hours away, or Sebehun Tarbema, which is 5 hours away. So far, a total of 150 women have stayed there. When the pregnant woman goes into labor, she is transferred via the RHCI Toyota Helix truck to the Takanko Health Center or to the Bo Government Maternity Hospital for a safe delivery. To date, no maternal or newborn deaths have occurred.
One of the most important things that encourages the women to stay at the birth waiting home is adequate feeding. We feed the pregnant women 3 times a day with breakfast, lunch, and dinner. The meal is prepared by the community health workers, and the pregnant women that are able assist them in preparing the meal at the home.
Established in 2015, the Outreach Motorbike Clinic serves the villages of Dodo, Lembama, Sunga, and Ballyhoon. This is a true partnership of RHCI with the local government-run Takanko Health Center staff. RHCI provides one of the 2 motorbikes and its driver, plus medications and stipends, all for $300 a month. Over 1,800 visits occur each year at the motorbike clinics, with mostly children with malaria and other acute infection being treated. Undoubtedly, many lives have been saved through this clinic. The Children's Health Program is RHCI's newest program in partnership with the people of Takanko Chiefdom. Made possible by your generous donations, we are able to transfer critically ill children to Bo Children's Hospital for life-saving care. A 4-day hospital stay costs as little as $45. The Children's Health Program also includes a program on malnutrition, malaria prevention and treatment, care for other infections, and improved access for immunizations. All this work is in partnership with the local healthcare workers and the community itself.
My name is Sarah Cassell, and I am the current board chair of RHCI. I can say that I'm just really grateful for our donors. RHCI cannot be what it is today without our donors. When we started RHCI, it was a vision. Alice had a dream, and we all said, yeah, that sounds great. But we know that we needed to put effort into it. So getting a group of people who are passionate about the work and who are really dedicated to making sure that we see a change, we see a difference in the lives of people in Takanko is just an example of how things can go well when you have the will. One of the things I want to highlight, I believe, is our partnership with the current community health clinic. So RHCI works with the current clinic so that we can go on a immunization campaign, immunization drive, to ensure that children under 5 will have their polio and their measles vaccine. And that way, you know, they have a better chance of not getting sick from these diseases. So there is a lot that RHCI does, but we cannot do it without our donors. We really can't. So we thank you for being here today.
Hi, my name is Gary Johnson. I'm a physician and public health professional and proud to be an original board member of RHCI. If you want to make a difference you can touch in a resource-poor community like Takanko Chiefdom in Sierra Leone, keep moms alive. There is no one who will care for a child, the future of the community, more so than a live mother. When a mom dies, hope dies for many families. The greatest health threat to an adult woman of reproductive age in Sierra Leone is having a child. Why do moms die in childbirth? For the most part, it's from basic obstetrical emergencies, such as bleeding, postpartum infections, and obstructed labor, the inability to birth the child. The basic problem, the world over, in resource-poor communities, is the separation and distance between women who need assistance birthing and skilled care. A midwife at Mbaume Mother's Home level of care and the availability of emergency transportation solves these problems. To make a real difference, one also needs a system of care that works every time and that is sustainable. The Mbaume Mother's Home sits smack in the middle of a chain of care connecting small rural villages with skilled care and transportation. I had the opportunity to live and work in Takanko for 8 months over a period of 1 year during which the waiting home was built. It's doing more than saving lives. It's serving as our base of operations in Takanko Chiefdom. It's a workplace for our staff, which includes 3 midwives, and a community meeting place. It's also a place of pride and hope for a community. Another thing you need to make a difference in the community we serve is a system that works for people every time. I delivered a great deal of episodic care, much of it life and limb saving. But it's an enduring system operated by members of the community that is our goal and exactly what we're accomplishing. Food and food security are inextricably linked to maternal and child health. We are growing orchards and crops to feed our awaiting home residents and staff, addressing the sustainability of our effort. We are also supporting the multiple collective farms allowing land-poor subsistence farmers, principally women, to put more food in the pot. And we're making plans to pilot a program in 1 to 2 villages that will improve child nutrition at a grassroots family hearth level.
Ms. Hassan Kamara, co-board chair for RHCI. RHCI has come a long way. As one of the founding members, I remember working with Alice Kape to find healthcare providers in our community to serve on our board. RHCI has very diverse board members, which is one of our strengths. We come together to improve the healthcare condition in Takanko. As volunteers in Minnesota, serving on the board, we help to raise funds to sponsor our projects in Sierra Leone. That is why we come up with these fundraiser events so that we will be able to fund all the projects that RHCI has undertaken in Sierra Leone. We therefore appeal to all of you to contribute generously to this project. I want to thank you very much.
My name is Sheikh Sharif, a founding member of RHCI. As a founding member, I have been very passionate about the growth of the Mbaume Mother's Home. There is a Mende saying which says, "Goyami atuabla." Together we can do more. Together, we can all work to improve the health of women and children in Sierra Leone, especially in Tikonko Chiefdom.
Oh yeah,